Hi, everyone. Thank you so much for joining us today for First Five in Focus. My name is Angela Spinelli,
And my name is Andrea Uribe.
and we are the First Five San Luis Obispo County interns.
Today we will be speaking with Eunice La Santa, a program coordinator for the Resilient Families Program, and Sylvia Wasjutin, director of MP Health and Mariposas Project, about the Mariposas Health and the First Five Resilient Families Counseling and Support Program.
Great. Eunice, we're going to go ahead and start with you. Could you please tell us a little bit about what the main goals of this program are?
Yes, thank you for having us today. Yes, the Resilient Families Program has the goal to help families from the San Luis Obispo County that are going through or they are feeling stressed or overwhelmed due to the social and physical distancing imposed due to the pandemic. We want to be a resource for the families to either access for the first time mental health services through counseling, or to continue receiving services that might have been disrupted due to lack of medical insurance or inability to access mental health services. Also, we would like to be to support the families through parent training or parent support in terms of assisting families getting ideas on how to work with their children at home now that they are doing school from Zoom, working with the little ones that may be in the middle with elders, siblings at home. Also, we have the wellness check-ins that are included in the program. If families don't feel comfortable or do not understand necessarily how they would benefit with the counseling or the parent support, we can also call them every 2 weeks and know where they are at. And if they need additional services, we may provide them phone numbers to contact other agencies that may address their basic needs that could be a reason why they are not necessarily thinking about counseling or parent support because their basic needs are affected.
And Eunice, how long has this Resilient Families Program been in place?
Well, we've been active since November 2020. It's been a slow start in November. As I mentioned, the families not always understand the need for counseling or to receive support through the program. But after we talk to them and they participate from the screening process and they go through the questions of the stress screener that provides them an idea of how they are doing in terms of employment or stress related to having children at home all the time, or the lack of physical and social contact with family members. So that kind of opened up their scope about what type of help or assistance they would need in terms of those situations.
I had a question about the screening tool. So this is a tool that you all use when you first start working with families, kind of just to gauge where they're at and what kind of resources you guys will need to provide for them?
Mm-hmm. Yes, the 15 questions have a Likert scale to determine where they are at in terms of child schooling from home, or what are the behaviors and feelings the child is experiencing at home, and everything related to how they are feeling either safe or not regarding to the coronavirus. So this gives us an idea of where exactly they would need more help. We've had families that have lost a parent or a family member. We have families that have experienced that they are currently experiencing housing insecurity and food insecurity. So those would be the first things to target to help them identify where to find help for the housing and food insecurity, and also keeping in contact with them through the process so they can have someone to talk to and go through what the steps they are going through.
Eunice, what is your favorite part of the Resilient Families Program?
Well, for me, I really love the fact that we have this initial contact with the families, that we don't really have to think about uh, other sources of funding, because usually when we have people call our office, we have to find a way to either guide them to where they can get funding to receive services, either for OT, speech, or counseling. They receive their initial run through what is counseling, what are these other supportive services, in order to have them in a place where they can breathe a little, talk to someone about what's going on, and then whenever we identify what sources of funding would be, like either medical, guide them through, get their services through their medical insurance. If they need to continue counseling, we can do that.
Also, are these families being referred to you guys from somewhere, or how do they come in contact with you all?
This is where a program like your program is crucial, because we have the funding, we have the structure, the support, but I don't think the community knows. And many times we talk with Eunice and we think, I'm sure there's people needing help, right? But not everyone can access because of not just being unknown. I mean, we try to connect as much as we can with many other programs in the community to be able to get the word out, right? To let the school districts know, if they have families that are struggling. But I think that just a program like yours, to being able to get the word out, will be crucial.
Sylvia, what is the most rewarding part of the work you do in this Resilient Families program?
I think I'll have to agree with Eunice that we, as providers, experience a lot of frustration when we receive phone calls from families that are clearly, or kids clearly needing help or not getting the help that they need, right? And we know they need help, and it's such a long process and such a fight for families to work with their insurance to be able to get those services covered. And sometimes they kind of get lost in the process, because you have to be very organized. If you have to have more than one child at your home, if you're working full time, you forget, to call the place every 2 weeks to see, where you're at. Are you on a waiting list, or what's the next step? You forget that, and then kids, lose some services. So for me, what's the most rewarding is not to have to deal with that. Thanks to the generous grant, from First Five, we not having to stress about the funding is huge. So it's very rewarding that when a family calls and they need help, we can say, yes, we can help you.
Yeah, especially because in these cases, time really is of the essence.
Yes, we're talking about mental health. When someone calls, it takes a lot of courage to call and say, I need help. So when someone calls, it's because they do need help now.